I'm good. How are you?
Yeah, good. Very nice weather. Doctor, the fundamental questions I have few. I want to ask you one by one. What is depression? How I can detect that I have depression? And how the people surrounding me, my friends, family, my life partner, know that I am in depression.
This is a very, very important point. The problem is, you said that how do I detect whether I have? The one major problem in psychiatric disorders now is that we don't have a diagnostic test. When somebody has diabetes, you don't have to do anything, just go for a blood sugar and 150, 200, you have diabetes. BP, there's no like a 200 set. You have a chest X-ray, ensures that it's tuberculosis. But here, there's nothing like any test which can tell that okay, you are depressed. So we have to mainly depend on how much of information you give us, how much of information the patient gives. But there are certain things which we try to differentiate. Number one, let me put it very clearly. Any of us can develop depressive disorder. There's nobody in this world who can say that I am very strong, I have a lot of willpower, I have this and I can nothing. It's like any of us can develop diabetes, hypertension, typhoid, like that. Anybody, starting from the age of 10, pediatric depression, childhood depression is also very well described, to the age of 70. In this age group, anybody can. Broadly, it's more common in women. People don't know what's the reasons. For every man who suffers from depression, there are 2 ladies who suffer from depression. Most common age group, I think this is one thing which is very important. The most common, generally people think that people suffer from depression in the old age. No. Almost about 40% of the patients, the depression starts between the age of 15 to 30. 15 years to 30 years, very young age. When he's studying, when he's going to the college, that's the time. His education, then his marriage, then his job, all these things can get affected if the depression is not treated. So that is what happens. Then how do I know? You feel sad. All the time I feel sad. The difference is, in normal sadness, it gets varied. Suppose you go for a movie, you talk to friends, you watch TV and then you read something, it gets lifted. Here, typically what they say is that most of the time in the day, majority of the hours in the day, most of the days in the week, and like that at least 2 weeks, if you have that, you get into, you're diagnosed as depressive disorder. Everything is negative, everything is black and white, there's no color, I don't feel like doing anything in life. And here another thing which is very important, I think I was talking about psychotic depression, bipolar, unipolar, and then like different types of depressions. Generally when we are worried about something, when we don't feel good, you go to bed, you don't get sleep. That's what usually it happens.
Yes.
Some thoughts keep coming and then you keep rolling inside and you get up and then go for have some glass of water, go to the washroom. But in one particular type of depression, what happens is something like melancholia. They go to bed around 9, 10. They sleep off immediately. There's no problem with the sleep. But they get up at 2. They get up at 1 o'clock. They get up at 3 o'clock. The late, that's like early morning they get up. And that is the time there is miserable feelings they get. This is typically in particular type of depression. They go to sleep immediately, no problem. But they wake up early. And then second thing is, today also I have seen one patient. Mornings are miserable. By evening they feel good. It's like a peculiar thing. It's difficult. Every day morning it's like all the negative thoughts, all the disturbing thoughts, all the I am hopeless, I am helpless, and then I can't do anything, and then I am useless fellow, and then I am leading a life like this, and how long to be, all those things. By evening they feel better, and again next day like that, and again next day. This is typically what we call as a diurnal variation. The other one, what we call as late insomnia, are typical classical features of a depressive disorder. People with this depression, they suffer from it, they come out of it very well. These are generally the symptoms.
This, when the patient
Yes.
tells you, or if he comes out, if he won't come out, the surrounding people like his life partner or friends, family should notice and
Correct.
bring.
Exactly. He may not talk about it. Generally, they don't say. That's another thing. Most of the time, when the patient walks in, they don't come and tell me, doctor, I'm feeling sad. He'll say, I'm having headache. I'm having backaches. I'm not getting sleep, doctor. I'm not going to the office, doctor. I don't feel like working. But here, most of the time, they don't feel that I'm feeling sad. Then you have to ask for it. So relatives notice suddenly he has become a little bit more dull, quiet, not talking, not attending office regularly. He's not sleeping well. He's not eating well. He's losing weight. Most of the times he's lost in his thought. He sometimes cries. I think at this point of time we need to talk about why do we talk about depression so commonly, so much, and then so much. The risk of suicide in depression is very high. That's one of the sad things. I think I told you 15 to 25 is the age group where 40% of people develop. That is the age where they are more prone for alcohol, cannabis and all that. Their education gets disturbed. And 15% of patients with depression commit suicide. They end up their lives in suicide. This is one area, if you identify early, correctly, you treat them well, they'll come out of it. They'll completely come out of it. They don't think about suicide. Doctor, can we treat depression? Yes. Definitely we can treat. So it's a simple problem, but only thing is identification and then correct treatment and then correct time which are going to be the problems. So relatives have to be definitely, especially because you ask this. Nowadays you see that. The moment the exam results are out, the next day almost invariably you see in the newspapers that at least 1 or 2 suicides. That's really painful thing. The parents have to be very careful about this. Like in case of any of these signs what I talked about, they have to support the child. They have to take care of the child. They have to give the maximum support to the child. That is where early identification, where we can to a certain extent. That's very, very important.
Doctor, I have an interesting question. What is the root cause of depression? What drives people to depression? And what sort of treatments that you give for this depression? And why people develop depression? What is that?
Very, very, very common. I think it's a very, very important question also. See, a lot of times when it is a medical disorder, people want to know. Doctor, why did I develop tuberculosis? Why do people get cancer? Wow, you smoke, you drink, your bad habits are there, your cholesterol is there, all those things are there. Like that, why do people develop depression? To tell you very frankly, as of today, maybe like I can say that similar to diabetes, nobody in the world knows why exactly somebody develops depressive disorder. But a few things I can say. Number one is genetic, hereditary, lot of importance. Same thing as diabetes. If your father, mother, somebody has diabetes, your chances of getting diabetes is high. Okay. Same way, in the family, if somebody has depression,
History.
yeah. General population, risk of depression is 5%. If your parent or one of your brother, sister, if they have depression, your chance of depression goes up by 15%. Then if you are a twin, it goes to 50%. So genetics definitely play a role. That's the first thing. That is, I am born with a kind of a vulnerability to develop depression. But that doesn't mean that I am going to develop depression. Second thing is, most commonly, it's a brain neurotransmitter. Some disturbance or dysfunction in the brain neurotransmitters, especially serotonin, norepinephrine, this dysfunction produces depression.
Oh.
Why this dysfunction, we are not very sure. So genetics, brain dysfunction, circuitry or neurotransmitter dysfunction, and to a certain extent maybe psychological factors. And I think I put the psychological factors last. What do you mean by that? Stress, develop. Everybody who goes through stress do not develop depression. Stress is stress, anxiety. They may get into worries and sadness and dullness, but they don't develop significant depressive disorders. So this is how the phenomenology. So generally we talk about he has got some problem. He is worried, he has got a financial loss, he failed in the exam, he developed depressive disorder. Need not be. Any of us can develop depressive disorder.
Is it gender specific or
More in the ladies,
more in the ladies?
and then more in the post-delivery period, and then 15 to 25, a lot of people have it. And here in depression, there's one thing which is a little bit of a tricky thing we need to understand. A lot of times, there is something happened, I got depressed. That's common, everybody knows. I got into financial trouble, I became. There's another way. I get depressed and then I lose in business.
Oh, yeah.
I want you to understand this. I lost money in business
Well,
and I became depressed. The other way is that last few days or months I got depressive disorder, which is a normal, natural kind of like anybody getting like a typhoid diabetes. But because of my depression, my decisions were wrong, my functioning was not up to the mark, I was not attending the office regularly, I was not able to manage things regularly. That is why I am. So that's also the risk. Quite a few times you see that. People relate to that, you don't know. Then another funny thing happens in depression. All of us have some small things which happened long time back. Some I did something to you and then I did some wrong thing and all. Generally we don't bother. When somebody is depressed, the thing which happened 10 years back, 15 years back, 20 years back, some wrong thing I did. 10 years back, I had to give the shop person 10
Incidents.
rupees. I cheated him.
Yeah.
Now that thing comes to light, which was completely forgotten and not there at all, which we call as a retrospective exaggeration of things. Retrospectively, a minor event that becomes a major thing now. I cheated him. I did something to him. That is why I am getting depressed. And then sometimes even say that retrospective falsification. The small things they exaggerate, they give some of the negative things which were actually not responsible for this, which is also something which we need to understand.
Geography, any geographical place specific like?
Generally not. All over the world it's almost the same. But they say that it could be because of many factors. I'll tell you one thing. Suicides. Suicide at one point of time is the highest number of suicides were in Kerala. The least was in Bihar.
Kerala is educated.
Exactly, that's a question which comes to me. Educated, highly literate, and then 100% literacy, healthcare is on the
Yes,
high, is there. And then the place like Bihar, it's almost nothing. So sometimes it's statistics. We may not exactly know that. If it is not reported, it's not there. So sometimes because of that also we get a slightly distorted. But depression is there all over the world, across all geographic locations. And then people say that only rich people get depression or only poor people get depression. That has nothing to do with that. One of my very common things which I say to just get across the point that any of us can develop depression, whether you are an American president or Indian Prime Minister or whoever it is. Generally, people sit with Amitabh Bachchan,
Yes.
Kaun Banega Crorepati. I sit with him today, I win 1 crore. I am the happiest person in the world. Tomorrow morning I get up and I say that I have depression now. I am not surprised. The reason why I am saying is that it's like somebody getting typhoid. Somebody like getting depressed. I am trying to exaggerate this by putting it like a little bit dramatizing that. But the point is that any of us can get depression. It's like any other.
Goal seekers.
It's like goal seekers, type A personalities, and then all things. They get worried, upset more. There are certain personalities, maybe if you can say that.
There's a lot
I
of
cannot
competition.
say yes. Obsessive compulsive personality disorder. They have seem to be having a little bit of higher percentage of developing depression. That's what I see in my clinical practice. These obsessive compulsive personality disorder people are. If you want me to give a brief description of that. They are very rigid, they are very strict, meticulous, orderly, they maintain everything perfect. It's one of the perfectionists. These people are highly perfectionistic, very punctual, very orderly, very meticulous. Everything has to go in a straight line for them. This is obsessive compulsive personality. Whenever there is a slight deviation, they get disturbed. Some other people can get a lot of irritation and then they get into real outbursts of temper also. Lot of times this personality disorder gives problems in adjustment. They do a very good job. They expect everybody else to do the same kind of a job. When it doesn't, they don't tolerate. So a lot of marital problems can come. Adjustment problems in the office can come like that. But these people are otherwise nice people, very frank people, simple people. And they always worry that why the world doesn't understand me, but they get into this kind of a crash. There's a high chance of these people getting into depression.
Do aspirations for cricketers, sports persons and artists, mostly they want to seek the higher goals and...
Whether they are more prone for depression, that's what you are asking.
Yes.
No. Need not be. But when an artist becomes, when a celebrity becomes this depression, it's all over splashed on the newspaper and that's where we come across that. Need not be. Any of us can get. As I told again, I repeat, depressive disorder can be like typhoid. Any of us can get depression.
Doctor, I have one issue. I come across few people, very literate and high-tech, high-profile jobs and all that.
Yes.
I know for sure they have depression. But when I told it's not a taboo, just go and see the doctor. Then they showed me a couple of movies. Like in English movies you have a lot of psychiatric movies and hospitals, the treatments, kind of treatments. And Telugu movies, it's like they show psychiatric
They
hospital.
slightly distort.
Yeah.
There's a bit of distortion.
Distortion.
Some exaggeration, distortion. See, movies they distort, they exaggerate. Otherwise, who will go and see the movie?
Yes.
If the hero is like you and me, then nobody is
yes.
going to say exaggeration. But we should not take it literally. That is correct. Sometimes the picture is distorted. That's another thing. I think we have come to another important point. Okay, I have depression. So then what do? There is no medicine. For a psychiatric illness, for an emotional disorder, if I can put it in Telugu, manovyadiki mandu ledu. That's it, ruled out. So most of what people say that if you are depressed, relatives will ask you, friends will ask you, people will ask you, why are you depressed? Do something about it. Don't you have willpower? Can't you manage this? Do something, cheer up, do. This is one of the very wrong things which people do. Because they don't know the quantum of depression. They don't know the severity of depression they are going through. This person does not have any problems. He is depressed like diabetes. So it's like asking somebody saying that, no, like, why are you worried about fever? Can't you manage your fever? Can't you control your fever? Exactly like that. That actually irritates them. So you need to understand somebody with depression. I am not saying that to encourage his depression. You need to understand. Hold his hand. Empathy is important. But when it comes to depressive disorder, I say that quite a lot of patients need medication. The moment I say medication, there is a lot of alertness that, oh God, these people are giving no. Very simple medicines. I'll just tell you in 2 minutes. Suppose a patient walks into my room saying that, now like he's got the problem, I diagnose him as a depressive disorder. I'll tell him, you need medicines, you need counseling. The standard thing what I do in my clinic is, I'll start the medicines, usually half a tablet or 1 tablet. I'll explain to them, look, you need to take the medicines. These are not sleeping tablets. You're not going to sleep in the day, only in the night. Right? You have to come for 2-3 sessions of counseling, talk to them, see if there's anything like that. A lot of times they want to be listened to. There may be a problem or not, they want somebody to listen to their issues. So I'll see them again after 3rd day. Make a small adjustment in the dosage. And then 5th day, 3 visits like that, stabilize the dose. 1 tablet, at the most 2 tablets. I'm not going to give them 10 tablets. 1 or 2 tablets. And 1 or 2 sessions of counseling. Support. Tell the family that this person is depressed. He needs your support. Don't leave him alone. It's one of my standard things I say that don't leave him alone. There's a suicide. I don't want to frighten them, but I want them. Don't push him into work. Let it be on his own. One of the most, actually today, problem is that my drugs take at least about 3 weeks. So I tell them that you give me about 4 to 5 weeks. Take the medicines regularly. If you feel like doing something, do. Otherwise, don't push yourself. Family members, support him. Don't pressurize him. Be with him. There is a suicidal risk. Take the medicines regularly. 3rd week or 4th week, majority of them do well. Doctor, I am much better. My depression is subsided. I don't feel like thinking about suicide. I'll go back to work, doctor. After 1 month or 2 months, can I go back to work? Yes. Can I go and study? Can I go for higher education? Can I go abroad, doctor? Can I do this? Can I do this? Anything, everything you do. Only thing is, please take the medicine. Because the medicines have to be taken for about 5-6. Generally we give up to 8-9 months also, depending on what it is. At the end of 9 months, I'll stop the medicine. 1 tablet, 2 tablets, doesn't cost much. Oh my God, there are a lot of side effects. Nothing, these are not sleeping tablets. At the most, it will give you a little bit of acidity. Nothing more than that. If you have a problem, come back to me. Come back to me. I don't want to give you side effects. I don't want to load you with too many tablets. These are not costly. These are not going to give you trouble. But please take. Why do you want to suffer yourself? Why do you want to take the risk of going into a suicidal attempt? By just 1 or 2 tablets, you can become alright. That is why sometimes I have to tell so forcefully, saying that I feel so sad. They don't understand. Family doesn't understand. It's a simple problem of depression. 1 or 2 tablets, things become alright, but they don't. They are worried. Memory disturbance. I get addicted. I have this problem, doctor. I have this problem. Will he become alright? Yes, he will become alright. Will he stop the medicines? Yeah. Quite a lot of patients I stop the medicines. But they'll ask me one thing. Will I get it again? Possible. I don't know. It may be after 10 years, it may not be there, or it may be after 1 year. But anytime you have it, we have reasonable, good medicines, safe medicines, no problem medicines. We can get you out of this. That is the most important message. Any of us can get depression. Depressions are not because of your family worries and it's because of the heredity and then brain neurochemical. And we have a reasonably good treatment, which is not costly, which is not side effect, giving you side effects and all things. Simple kind of a treatment.
Do socio-economic conditions also lead to depression?
If you ask me, does it produce depression? No. Poverty can give sadness, but they don't go to depressive disorders. But the point here is that he may not get it treated. She may not get recognized, so that may lead. And it's like this. My fracture is a physical problem, but repeatedly something happens without breaking it, I'll have more fracture. That's what can happen repeatedly now, hitting the psychosocial problems, repeatedly psychological thing, hitting again and again and again. It can precipitate. It's like this. I am born with the vulnerability to develop lung cancer. I am born with a kind of a genetic vulnerability that compared to you, I am more susceptible to develop lung cancer. Now if I smoke continuously, my chances go up like this.
Oh.
Suppose I don't smoke and I keep this, even the vulnerability, I need not develop cancer. Similar thing with depressive disorders. So the whole world is genetic. All medical disorders are genetics within that. So we can protect. Then how do you protect yourself from depression? Doctor, is there any way that I will not develop depression? A lot of parents ask me, my son is like this, can you tell something so that he will never develop? I can never say that he will never, but certain things. But it's very routine things only. I don't tell them complicated things. As far as possible, 7-8 hours of a good sleep at night, half an hour of some exercise, 5-10 minutes of some relaxation. When you have depressed and then taking medicines, I tell them generally don't take alcohol. Simple exercise, a bit of relaxation, take the medicines, and reasonably good lifestyle, relaxed lifestyle. This is not something I don't have to tell anybody. All of you know what is the relaxed kind of a lifestyle. But how far we practice is a different thing.
Nowadays, doctor, these youngsters from 5-year-old kid to 65-year-old man are used to gadgets, electronic gadgets. They are not living, they are not going out. Without that they think that there is nothing here. They lost everything. Is that the root cause of depression?
No, that's a very difficult question to answer. That's a very sweeping statement you made. Whether the gaming itself is going to lead to depression, I don't say that. But the only problem with that is that a person spends more and more number of hours on something which is reasonably less productive, and then it's getting a kind of hooked to that. Like, that's the only thing I say. It's not good for your eyes, it's not good for your sleep, it's not good for your other social habits. It's only that I can say that. Beyond that, this leads to depression. No. This disturbs socialization. That can
Some
disturb
sort of
relationship.
news is coming and he is getting depressed with political news or
Right.
social news.
Difficult to say that. Because we have seen people who have gone through horrible times and then did not get depressed. Changing times. See, like the other day when we were in a public meeting, one lady got up and then asked us, "Sir, one small request from all of you psychiatrists, please do something to cut off that TV business." She's so distressed that the son is watching TV day in and day out. She said, "Do something to stop this." It may not be correct question to ask. When the child goes on seeing this one, I'll ask some of the mothers, "Amma, how much time you watch the serials?" The same thing is happening here. So it's becoming a universal phenomenon. We can't stop the whole thing, but minimize that. Like fast food.